What's up, guys? Welcome back to the nursing channel. In this video, I'm going to teach you guys about hypokalemia in less than 10 minutes. I'm only going to show you guys the information that you guys really need to know to pass your test, to pass the NCLEX. So I'm going to show you that information that you really need to know about hypokalemia. Only the valuable information, because I'm seeing a lot of other YouTube videos that talk about hypokalemia, but they take like 45 minutes, almost an hour just to explain this concept. There's a lot of things to talk about hypokalemia, but I'm only going to teach you guys the important things you guys need to know. Not everything else that you won't see in the NCLEX or in your nursing exam. I just want you guys to have that very important information that you really actually need to know. And so that's what I'm going to teach you guys right now. Let's get into it. Hypokalemia. If you break down the word, hypo means low, okay? Anything with the word hypo, you know that means low. Kalemia. The words E-M-I-A mean blood. So you put it together, low potassium in the blood, okay? Now, normal potassium blood levels are in the range of 3.5 to 5.0. So anything between those numbers is normal. Now, anything outside of that range is called abnormal. Okay, so when we talk about hypokalemia, we're talking about potassium blood levels that are below 3.5, okay? Now, what are the signs and symptoms of a patient with low blood potassium levels, okay? The first one is they have weak and thready pulses. So when you check a patient's pulse, you know, you're gonna notice that their pulse is very weak. It's not rebounding. You're not gonna be able to feel it as much, okay? The other signs and symptoms of hypokalemia are hypotension. So remember that word hypo means low. So we're talking about low blood pressure. If you notice that your patient has low blood pressure, that's another sign that they can have low potassium blood levels, that they can have hypokalemia. Another one is decreased deep tendon reflexes. What does that mean? Have you ever hit your funny bone? Have you ever hit your funny bone, your elbow against something hard, and you notice that it reflexes that way? Or when the doctor comes with a little mallet and he hits you right here in your knee and your leg goes like this, it kicks out. Those are your deep tendon reflexes. So when you have hypokalemia, those reflexes aren't as obvious. You don't do this as much. Okay? Another sign is lethargy. What is lethargy? Lethargy is just feeling weak, without energy, no motivation to do anything, okay? The other sign and symptom is confusion. The patient's confused, The way you know a patient is confused as a nurse is you always ask the patient, what is their name, their date of birth, do they know where they're at, do they know why they're here? What is today's date? Who's the President of the United States? Those are ways you can check for the patient's orientation status, and that'll let you know whether they're alert and oriented or if they're confused. Okay? Now I put a star next to this sign and symptom of hypokalemia because it's the most important one. This is arrhythmias, abnormal heart rhythms. Okay? When you have hypokalemia, the biggest sign you should be looking for is what is the patient's heart rhythm, because hypokalemia can lead to arrhythmias, and not just any kind of arrhythmias. It can lead to life-threatening arrhythmias, okay? So that's why I put a star here. And so when you look at the patient's EKG with hypokalemia, when they have really severe hypokalemia, you'll notice on the waves that they have ST depression, and they also have shallow T waves, okay? So this is information that's important. All right, now let's talk about the causes of hypokalemia. What can cause your potassium levels to drop below 3.5? Okay, one of the causes is drugs. We know that diuretic medications can make you lose potassium. What is a diuretic that you know about? Which is what is one diuretic that we all know very well? It's called Lasix, right? Lasix is one of the biggest diuretics that patients receive in the hospital. And what Lasix does is it makes you get rid of fluid in the body. And how does that happen? Lasix will make you urinate all that fluid out, okay? But not only are you losing fluid with Lasix, but you're also losing potassium. So what's going to happen is your potassium blood levels are going to drop, okay? Another one is glucocorticoids. That's another type of medication, or insulin. Getting too much insulin will also drop your potassium levels. Another type of medication that will drop your potassium levels is laxatives. There's a lot of laxatives that will make you lose potassium in your stool. Okay, one of the biggest laxative medications that I know about that can make you lose potassium is Kayexalate and also lactulose, because you're losing a lot of potassium in your stool. All right. What's another way that you can have low potassium levels? Is you're not eating enough potassium, and you don't have enough potassium in your diet. You're not ingesting enough potassium, okay? There's also diseases that can lead you to have low potassium levels, like Cushing syndrome, okay? Cushing syndrome will cause you to urinate potassium. And so most people that are diagnosed with Cushing syndrome, you always want to monitor their potassium levels because they tend to always be low. Another cause that can cause you to have low potassium levels is too much water intake. When you drink too much water or you get too much IV fluids, that will dilute the potassium in your blood, causing you to have low levels, okay? Another cause is increased fluid loss. Increased fluid loss. How can you lose potassium through fluid? Let's say you have an NG tube and it's to suction. The NG tube will start to pull all of your stomach contents out, and not all of that fluid can contain potassium. All of those stomach contents can contain potassium, and so you're taking away all the potassium from your body through the NG tube, okay, when it's to suction. Also, when you have vomiting and diarrhea, you can lose potassium through all the contents that you vomit and through all the stool and fluid that you have during diarrhea. You can lose potassium in there, okay? Now let's talk about what to do with a patient that has low potassium levels, that has hypokalemia. One of the main things that you want to do is put your patient on a cardiac monitor. Put them on a heart monitor, okay? That's the biggest thing, because you want to prevent and you want to monitor for any heart rhythms, any abnormal heart rhythms, okay? When you, with a patient with hypokalemia, let's say they have a medication that's due, like Lasix, you always want to, or they have a laxative that they need to take that's on their scheduled meds. You're going to look at those meds, you're going to look at your your patient's lab values, you're gonna look at potassium and be like, nope, I'm not gonna give my patient another diuretic or a laxative because their potassium levels are low. Let's say they're 2.5. If you give them Lasix, it's gonna drop that level of 2.5 even lower. Or if you give them too much insulin, it's gonna drop it even more. Or a laxative will also do the same thing. So you wanna notify the doctor and let them know, hey, my patient's potassium levels are low. Can we hold the Lasix? Can we hold the laxative? Can we not give the insulin? Can we do another alternative? And notify the doctor so that he can find something different, okay? Another thing you have to do as a nurse with your patients that have low levels of potassium is educate them to eat potassium, to include foods that are rich in potassium in their diet. I'm gonna give you some examples of foods that are high in potassium. Oranges are high in potassium, bananas, raisins, fish, avocados, potatoes, all right? And all these foods sound so delicious, they're making me hungry. Another way you can fix low levels of potassium is you can give them IV potassium. Through an IV bag, all that fluid will go through their vein into their system, and that'll increase their potassium levels. Or you can give them a tablet, a potassium tablet, and they'll take it, potassium supplement, and that'll increase their potassium levels. One thing to keep in mind, if a patient has a potassium level of lower than 2.5, never give potassium via IV push or intramuscular, okay? Because that can cause a sudden change in their heart rhythm, okay? So you never want to do that. Remember, that can be a potential question on your upcoming exam. Also, if you know that your patient has low potassium levels, but they also have a history of congestive heart failure and they're receiving a medication called digoxin, are you going to give that digoxin to the patient? I'm going to give you a few seconds to think about it. The answer is no. You're not going to give the digoxin. You're going to hold the digoxin and notify the doctor. Okay, guys? All right. So I hope that all this information helped you guys out. This is the most important information you'll need to know for your exam. This is the type of information you'll need to know for the NCLEX so that you can be ready for it. All right, guys. Let me know if you guys got any other questions or any comments. Don't forget to like and subscribe to this channel. I hope this video helped you out and you learned something. All right, guys. This is Nurse Sam. I'm out. Peace.